and walked around the floor of the hospital like 15 times by myself.
So we're here with Dean Reiber, who underwent a L4-5 lumbar fusion 2 weeks ago, and he's going to tell us a little bit about that. Now, you have a history of lower back and leg pain?
Well, it's, can I use the word unbearable?
Yes.
Because that would be the best way to describe it. I had not so much pain in my lower back area, but all the way down my left leg.
Okay.
Starting my buttocks all the way to my toes. Pain, especially in the mornings, difficulties getting up, difficulties walking.
Difficulty with activities of daily living and stuff like that?
Absolutely. When you got to lay on the floor to get dressed, it's a real chore.
Not a good thing. What kind of work do you do?
I'm in the entertainment nightclub business.
Oh, okay. And so you had difficulty with that?
I had difficulty basically all day long, Doctor.
Okay. Then what type of treatment did you have initially?
I went to a chiropractor first, which of course gave me no relief at all. And then I went to pain management, and then they referred me to your doctor's office.
So then they did some of the injections in the back?
Yes, I did the epidural injections, regimen of 3.
Okay.
And that was a very, very short remedy.
Okay. And then you recently underwent a lumbar fusion, L4-5, and that was about 2 weeks ago, correct?
13 days ago.
Excellent. What was it like the day of the surgery? Was it what you expected?
Well, I was very nervous because I did not know what to expect. It was my first time having any kind of surgery at all.
Never been in the hospital?
Never been in a hospital, not since the day I was born.
So the hospital can be a pretty frightening place?
Yes, it was very, very unnerving, very anxious feeling.
Certainly.
When I went in the morning and prior to going into surgery, you came and did a wonderful job explaining everything to me. I probably didn't retain everything, but you did a wonderful job explaining everything and told me what to expect, which was much appreciated.
The surgery was, they gave you medicine to put you to sleep, took you back to the OR.
They took me to the OR.
What do you remember
I
from that?
remember nothing, saying, well, we're going to give you some oxygen. They put a mask on my face, and I woke up several hours later, not knowing anything or anything that had occurred in recovery.
And then when you woke up, a lot of pain, not a lot of pain?
No, I was laying in a prone position and really not much pain at all.
And then the first time you got up and started walking, was that a lot of pain?
The first night I was in the hospital, when they asked me to roll over on my side so they could check everything, that had some pain and definite discomfort.
Okay.
But the next day I was up, the physical therapist came and I was up walking and walked around the floor of the hospital like 15 times by myself.
And so then you left the hospital the next day.
I left the hospital about noontime the next day.
How did you get home?
Well, I had a ride come to get me, but I had a vehicle there at the hospital, and I said, you know what, I'm fine, and then I drove myself home. Again, I realized not recommended by the medical staff there at the hospital, and I'm sure yourself.
He drove himself home, but we do not recommend that. Okay. So you drove yourself home, you got home, did you go straight to bed?
No, I stayed up and tried to maintain a normal activity, and I walked around the block a few times, did that several times. I experienced that the less that I did, the worse I felt.
That's true, yes. The more you do, the quicker you do, the better you do, as a rule of thumb.
Absolutely.
And then, so now you are 2 weeks, almost 2 weeks after the surgery. You were driving the day after surgery, so I take it you're driving now?
I certainly am.
Are you able to do most activities of daily living? Or?
The following day after I was released from the hospital, I drove to work, went to work and resumed pretty much my normal activity.
So how much work did you actually miss with this?
2 days. I was in the hospital for the complete day, and then the day I was released, I didn't go to work, so 2 days.
Okay, excellent. Tell us about your pain at this time. What do you feel when you're doing stuff?
Right now, other than still a little numbness in my left foot, I don't have any pain in my leg at all, and I have not after the surgery. I have soreness in my lower back, of course, where the incisions were made. There's bruising and soreness, but other than
Kind of looks like somebody beat you up.
something like that, yes.
Somebody beat him up.
And I had to pay for it.
I don't know who it was, but we're still looking, okay? So overall, good experience, bad experience, are you glad you did it?
So far, I am so relieved that I did it. Again, being so nervous prior, it's easy to say, should I do it, should I not? If there's doubt in anyone's mind, jump in and do it.
Yeah. Everyone always says, oh, surgery on the spine, I can't believe it, don't do that.
Right.
You know? Okay, well, anything else you'd like to add or anything else you can think of?
I just want to thank you for returning me to normalcy.
Thank you very much. I'm glad you're
Very
doing
welcome.
well. Have a good day.
Thank you, sir.